Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own? It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g. labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Internet high five from an oncology patient. Thanks for doing what you do. Chiming in to agree with the other poster. My son had cancer and his doctors were amazing and kind. You really look to your oncologist for answers, and sometimes, hope. So, thank you for what you do. Part of why I, and many others, went into the field was for the especially close relationships we can forge with our patients, and what we can do for them during an incomparably tough time in their lives. So, it's our pleasure. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. Real question is, do you understand the prescription the other doctor writes? We don't really write prescriptions much anymore, usually it's computer generated. Best change ever emo. Now I know what I'm getting before I get the pills. Gives me a fantastic opportunity to Google the pills and catastrophize before I even take them. Took me a minute to realize this is a handwriting joke. 2.5 milligrams of Rumbleburl. I don't get involved in the management. I let the doctor seeing me lead that unless they miss something huge, and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds etc., then yes, they do discuss stuff like it's a group projectist. How was it growing up for you? Did she get over every little ache and pain, or were you just told to walk it off because she's seen so much worse? Asking because I know experiences from both sides. My grandparents were both physicians and lived with us while I was growing up. Grandma was a pediatrician and Grandpa was a surgeon. Anytime I had an ache or felt sick, she would examine me, then go to her bathroom medicine tablet and bring back medicine in a little paper cup. It always made me feel better. I later found out it was always a children's Tylenol. She was faking me out with the placebo effect. If I was actually sick, my grandma would have my mom take me to another doctor, as she was no longer practicing and couldn't order tests or prescribe medication. That's actually super sweet and adorable. I'm an ear doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk, where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of my aunt is a nurse, and she said need a whole-body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same, and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed-down spiel about things, and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year, I had a great time chatting with the anesthesia nurses about protocols until they drugged me. Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent, and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since I'm myself. If I go to a doctor, say a gynecologist, for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies. And that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with any patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation. I wish I could do that with my kids. I am not a doctor at all. I am a sonographer and do ultrasounds. I work at the same hospital that my children's pediatricians group works. When my son was born in April, he ended up in the NICU. The fact that I knew everyone up there from scanning in the department was comforting. I know they are good people and practice well. At one point the NICU doctor said, "Well, you know how that is," and I had to tell her, "No, I have no clue how that is. I don't do diddly squat with lungs. I know the basic anatomy and that is it." Which is true. Lungs have air, so ultrasound doesn't go anywhere near lungs. She told me I was going to get the normal script from then on out, so don't feel insulted if she told me things I already knew. Nope, explain it to me like it's my first day ever setting foot in a hospital, please. That way no one assumes someone picked up what was left down. If anyone wanted to better understand what a high context and a low context culture is and how they impact communication, these are excellent examples. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first in his cancer treatment, he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. Doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. When I go to the doctors, it's also like a group project. I let everyone else do the work and reap the benefits.